Frostbite is when ice crystals form in a patient's tissue, and so that can affect nerves, blood vessels, or the tissue itself. Frostnip is a milder version of frostbite. In these cases, that can be treated at home, but in frostbite, that's a medical emergency, and you need to see a healthcare provider. Usually you'll see redness in the skin, and maybe the child will complain of tingling or numbness of the skin. And so if your child's outside, it's below 32 degrees, and especially in this area if it's windy, because if it's very windy, it can make it cooler faster. So if you notice your child has red skin and complaining of numbness, tingling, be concerned about frostnip, get your kid inside. Kids lose heat much faster than adults do. They evaporate heat at a greater rate than adults do because they have less fat tissue and their skin is more thin. And so kids' skin can lose heat quicker than adults, number one. And then the risk with kids is they're having fun outside. And as adults, we're cognizant about, oh, it's really cold outside, we need to come home, drink some hot cocoa. When kids are having fun, they're not as cognizant as adults, and so they want to stay outside no matter the risks and continue to having fun. Layer, layer, layer. Don't forget about cheeks, ears, fingers, and toes, and so make sure your child is appropriately dressed for the winter time. Totally okay to go outside and have fun, but limit the amount you are outside. And then if you notice these symptoms that we mentioned of frostnip, like redness of the skin, a child complaining of this numbness or tingling, have that child come inside and rewarm your child. So if you're worried that your child has frostnip, first bring your child indoors, change out their mittens or gloves into some dry clothing. In the affected area, take warm water, usually about 100 degrees Fahrenheit, and submerge the skin in that area until that child can feel sensation to the skin again. One point is don't rub or massage that skin. A lot of times parents will want to take a heating pad or a warm towel and rub that area. Try not to rub that area because that can cause or incite more tissue damage. And so change clothing into dry clothing, warm the area with water, and avoid rubbing that area. I like putting Vaseline after the fact. So when the kids come back indoors, okay to put Vaseline to kind of to protect that area and prevent damage from the cooling to heating that's going on. But I love Vaseline, and I think when they come indoors, lather your children up so their skin is protected.